We're not aware of a lot of complaints or concerns that came in to MLA offices that people would have rather have just taken their severance. Most people were, none of us wanted to go through the pandemic, but the workers that were affected by it, that were out of work, were glad that they had the benefit. And I think the few that I talked to like the idea that they still had the tie to the worker, the employer. They could say, well, I expect to be recalled or whatever, I'm off during COVID, and hopefully it's shorter rather than longer. But that seemed to be the general reaction. So anyway, I understand there's more than one way of looking at it.
And yeah, I mean, except what you're saying about the feedback you heard. The feedback I heard was certainly different from workers. But moving on, I was also wondering, in relation to the stagnant funding for these areas that I've listed, are inflationary costs taken into consideration with budget decisions under the Ministry of Labour?
The budget is submitted and prepared by the officials. Part of the whatever changes there are to the collective bargaining agreement, a goodly number of the workers there are SGU members, and so they would have those type of costs plus costs of vehicles, etc., would go up. The budget was well presented by the officials, and there was support for their needs when it went to Treasury Board.
Okay, thanks. And I know you noted that some of the staff would be, some of the workers would be unionized, but I'm sure many others would not be. And so in the case of those workers, are inflationary costs taken into account?
Sorry, missed the question.
Okay, so you had mentioned that there's collective agreements in place for some of the workers who are unionized. I assume there are, by your answer, like others who are not unionized. And so for those workers, were inflationary costs taken into account?
The out-of-scope workers would receive the same compensation changes as the in-scope. I'm not sure where they are in the pattern that was across government. I'm not sure where they were, but the out-of-scope workers would have been treated exactly the same. You'd asked about when the benefits had ended with regard to, it was July 25th of last year.
It's good to know. Okay, and then I'm going to move on to some general questions, bounce around a little bit from topic to topic. And the first one, being that it's Equal Pay Day, I'll start off with this question, Minister. Was the ministry involved in the Status of Women Office's pay equity legislation jurisdictional scan?
No, I don't believe that we were. I think that's something that they would have done themselves.
Okay, so there was no collaboration between the Status of Women Office and the Ministry of Labour on that front?
There may have been some that may have shared some information on it. We often will have a discussion as to who will present, who will take a question or not. So, but I'm not aware of any specific on doing research or doing background. Okay,
that's very good to know. And so, Minister, I had my Status of Women estimates last night and had a bit of a chance to ask that minister about this topic and this situation. And so in your perspective as the Minister of Labour, is this something that your ministry will be looking at in the current budget year and taking into consideration and contemplating in terms of implementing this sort of legislation?
I can give you a little bit of background. In September of 1994, which was before my time, Cabinet made a decision to address pay equity in executive government and the Crown sector through collective bargaining. So they approved, open quote, equal pay for work of equal value and pay equity policy framework, which established a framework for setting out the minimum standards for pay and internal equity initiatives for executive government, Crown corporations, Treasury Board agencies, boards, and commissions. So that framework requires pay and internal equity plans to be negotiated within a collective bargaining framework by joint employer-employee committees. So the effect of that is that Since 1994, there has been a pay equity plan in place for all crowns, executive government, and health authorities. So that exists within the, across the public sector since 1994. Now, the private sector is not covered by that. They would be covered by provisions of human rights code, etc. So far as I know, Ontario and Quebec are the only provinces that have pay equity outside of the private sector. They are the only ones that have it across public sector, or in the private sector outside of government. So we have it where it is now, and as a result of that, I think we have minimal number of people that come forward to this office or to the Labor Relations and Workplace Safety. Since 2021, going back to 2006, there have been a total of 25 claims that were made. And they, 206, 221, 021, 2013, 5023. And so we're down to a trickle of people coming in, not saying that those people don't deserve to have it, but those were issues that were resolved. So very, very few people come forward under the issues of those disparities. So I think the work that was done going back to 1994 to ensure that a framework was established. We've done a lot to try and move things forward within, and not saying there isn't more work to do or more things to be looked at, but that's the status quo within Saskatchewan public sector.
Okay, thanks for the little history lesson. I do appreciate that. I don't mean that to be condescending. I do appreciate that. But some of this I was aware of, and certainly I'm aware that this was implemented in the public sector years ago. However, as you noted, the private sector is not covered, and so I guess I would wonder why the government feels that and governments in past have felt that the public sector warranted pay equity schemes and not private sector workers. So all, the majority of women who work in the private sector. And after that, I do have a question just to clarify one of the things that you had mentioned.
I think it becomes incredibly complex to go into the private sector because the workplaces differ greatly. It's hard to deal with. But we have had legislation in the province since 1973 that indicates female employees cannot be paid less than a male performing similar work in the same workplace. So I think one of the challenges is if you have 3 or 4 different workplaces, is it a difference between the workplace, or is it a difference between the pay that's available to men or women in the same place? In 2014, legislation was amended so an employer could not pay one employee a different rate based on any of the prohibited grounds in the Saskatchewan Human Rights Code. I haven't looked recently at a number of complaints that had come out of Human Rights Code or Human Rights applications, but I used to look at that periodically. I don't have that ministry at the present time, but I would look at their stats that would come out, and they would occasionally have somebody that would go there. They would often get a resolution or whatever, and I'm not aware of any recent ones that had gone forward to a hearing or having a penalty imposed.
Okay, thanks for that.
I think it's something that all of us want to do the best we can to ensure that we treat people of all genders within the workforce. So I understand the point you're making, and I think it's something that all of us should listen to and take heart. We may not agree on where we go with it, but I'm supportive of what you're I'm supportive of the position you're advocating.
Well, I'm glad to hear you're supportive in principle. However, support from a government in principle doesn't mean much for women who are paid inequitably in the private sector in our province. Not to be rude, Minister, but so I have a few comments, I guess, and follow-up questions. You mentioned it's incredibly complex to implement this legislation in the private sector, and I mean, I suppose there is, something to that, but it's been done in other jurisdictions. So it's, there's certainly cases that our government could look at and model legislation around. You mentioned legislation in 1973 for similar work in the same workplace. So this is a common kind of conflation of two very different things, and I've heard numerous folks on your side make this, I guess, error. And I think, some probably do know that similar work in the same workplace, like a man and a woman being paid the same for doing the same job, is very different from what we're looking to address here with pay equity legislation, which is addressing the issue of equitable pay for work of equal value. So not the same job, but work of equal value. So just as a quick example, you look at, for instance, continuing care aides in our society. They're paid quite low wages comparatively in our province, and very heavily female-dominated occupation. You look at, used this example last night as well, library workers, childcare workers, all heavily female-dominated. And you see as a pattern that the most heavily female-dominated occupations are, in almost all cases, the lowest paid in not just Saskatchewan, but in our society. And so that's the issue, that's the crux of the issue that we're getting at here. So just to clarify that, and you mentioned too, prohibited grounds, and yes, I do know that that exists, and as you know, in the petition I present here in the House day after day, it's been noted that yes, that mechanism does, that complaints process does exist through human rights. However, it's complaints based, meaning that it's reactive instead of proactive, and meaning that there are barriers in place for, in this case, women who are looking to seek resolution to, an inequitable pay situation. So it's a very time-consuming, lengthy process that, I'm just going to be honest, I think most people aren't even aware of that this exists, which is problematic. And so I guess that's my counter, Minister. And I did have just a clarifying question. I mean, I could talk about this all night, but I better not, because there's other matters I have to get onto. But just one clarifying question. You had mentioned since, from 2006 to 2021, there were a total of 25 claims made. And what was this through? I don't think you were referring to human rights. 25 claims.
Those are within the ministry, and those ones would have been directed to the issue. But I'll let Mr. Tour speak specifically. So
in 1973, it would have been the Labour Standards Act, but now the Saskatchewan Employment Act includes employment standards, and so that's included in there. So the mechanism, as you mentioned, for making a complaint, an individual who feels they're being discriminated against based on sex, would have the opportunity either to go to human rights or to come to us. And so when it comes to us, we'd assign an officer. They would investigate, go into the workplace, determine whether or not there was a differential in pay that wasn't based on seniority or merit. And if there was, so we would work with the employer to make sure they rectify that.
Okay, thanks for clarifying that. And just a question out of that, for my knowledge, a worker could use either process, and one would be held in abeyance while the other was being seen through, and which would have priority? Is that case by case, or?
Yeah, it would be up to the worker, really. I am aware of one example in the last 5 years where that exact thing happened, where they filed a complaint with us, made a determination they wanted to go to work, or to workers' compensation, wanted to go to human rights, and then they and so ours was put in abeyance.
The Human Rights Commission, as well as the representative, has the expectation that they would look at there are areas of overlapping jurisdiction, so a worker would be able to go to either one, but the remedies that they would seek if they were would be taken into account on the second application. So it's an area that some people have suggested we address legislatively so that people can't shop for different ones. We've chosen a conscious decision to leave it there so that workers got more options. There may be other issues in the workplace that don't exist that would not be covered by the labor standards legislation that we have, and that would be better covered through human rights tribunals. So it's there, but it seems to be between the two agencies, they seem to be able to unravel things.
Okay, thanks for clarifying that. Like I said, I think I'm going to have to leave it there for today. But I would ask, Minister, that, as I've asked the Minister for the Status of Women to take a look at this and seriously take it into consideration. I mean, we've been bringing this forward for well over a year now, closer to probably a year and a half, and there's really been no response and no efforts at bipartisan collaboration I felt around this issue, which has been disappointing. And it feels like, it seems as though, this is an issue where it feels like the government is not interested in looking at implementing this legislation in the private, in this case for the private sector, because of the impacts that are probably assumed that would be felt by businesses. And correct me if I'm wrong, but I mean, is that the reason that the government does not want to look at this?
Back to the 1994 decision, it was determined that that would be an appropriate thing to do within the public sector. That the various positions that took place, there would be the ability on the part of the civil service to look at, to analyze, and make a determination on the degree of comparability, what the value, et cetera, is. They made the determination at that point in time to do this by way of policy, and it's worked since that date. I think when they went through that process, they would have made whatever determination they did, that they didn't feel they wanted to go into the private sector, nor did they want to enshrine it in legislation. And that's been the status quo through going back to the beginning of the Romano period, through the Calvert period, through the Wall period, and now through the Moe period. That seems to be a status quo, and I can't speak to other provinces. I know that it is done in Ontario and Quebec, but not done any further west than that. Not done in Manitoba, not done here, not done in Alberta, not done in NDP, British Columbia, and not done anywhere in the Maritimes. So I can't speak to the various reasons, and I think at this point in time, people are focusing on moving forward and trying to get through the COVID issues that are still there and still affecting the challenges that we have in the workplace. We're wanting people to get back to work. I haven't had discussions with other provinces on the issue right now.
Thanks, and just, for the record, I wasn't really asking about other provinces. I was asking about your government and your ministry, but I'm going to move on. Some questions, you won't be surprised, around paid sick leave, Minister. Workplaces have been one of the main locations where COVID spread has been occurring over the past 2 years of the pandemic. Frontline workers in particular continue to be exposed to COVID at very high rates. Frontline workers in the retail and hospitality sectors especially are some of the lowest paid workers in our province and have some of the lowest rates of paid sick leave available to them. Given that Omicron is much more highly transmissible than previous variants, and spread is as a result much higher, will your ministry be introducing paid sick leave in this budget year?
We don't intend to at this point in time. We provide within the existing legislation 12 days of sick leave 12 weeks of leave for a serious illness, personal injury, or illness of a family member, leave for work-related injury, 26 weeks. That ties to some of the benefits paid by the federal government for some things that are there. The Act also provides job-protected leave for maternity, adoption, parental, critically ill family care, crime-related death or disappearance, and compassionate care, and leaves that are covered by employment insurance. It also covers leave for interpersonal violence, reservists, nomination, election to public office, citizenship ceremony, bereavement and organ donation leaves, the things that are not covered by employment option. Right now, the only thing that has a paid component is interpersonal violence. Employers are required to provide 5 paid days of the total of 10 days of leave that can be accessed for that year. The federal government established the Canada Recovery Sickness Benefit, which provides employees up to $500 a week before taxes for up to 2 weeks due to being sick or required to self-isolate due to COVID-19. That program has been extended to actually later this month. I don't know whether it's going to be extended further or not. We're pleased that the federal government has provided that funding and that benefit. We are not prepared at this point in time to legislate paid sick leave at this point. Assuming that all employees in the province were to use the 10 days, it would have a financial impact of $1.2 billion, assuming that all of the days were used. I'm not saying that they would or could be, but it would be a significant expense. We look at what the overall things that are available in our province, and we are one of the provinces, or we are virtually unique in that we have a starting point of 3 weeks of holidays, 15 days paid holidays. Virtually every other province has a starting point of 2 weeks. So we have an additional 5 holidays that other jurisdictions don't have. Now, it can't be automatically used for sick pay, but when we look at a comparison of employer costs and where we go on it, I understand the argument that's being advanced that you don't spread it to other people, but it's not something we're prepared to do at this time. I've had the discussion with Lori Jobe from the SFL, and she presents a good argument, but it's just not something we're prepared to do as we're slowly but steadily coming out of COVID.
Okay. I appreciate hearing that answer. And so, you mentioned that we have 3 weeks of paid holidays here in Saskatchewan, and so I guess based on that, my question to you is, do you believe it's appropriate that employers are required to offer paid vacation leave to all workers in Saskatchewan?
So far as I know, that's our legislation. It requires paid vacation to everyone. But what we had been talking about was paid sick leave. The federal government and federal employers provide 10 days paid sick leave. Alberta does not. British Columbia offers 5 days to employees with at least 90 days consecutive service. Manitoba does not. New Brunswick does not. Newfoundland Labrador does not. Nova Scotia does not. Ontario does not.
And do not, thanks. Though.
Yeah. One day. Quebec, 2 days. And I think it's exactly the same reasons that I did. It's a cost issue, so when we look at the jurisdictional scan, it appears we are at a similar position with other jurisdictions.
Okay. So the reason I asked, about whether you believe that it's appropriate for all employers to be required to offer paid vacation leave, I mean, this is something that didn't always exist, right? This was not a standard given across Canada, but yet here we are today where that's the expectation and that is, the law across Canada. And so I would assume, through your ministry that that you would want to look at ways to pioneer basic benefits for working people in this province and to set a standard in this province, as we used to do in Saskatchewan. And, I would encourage that. I think, by, getting on board and, offering 10 permanent days of paid sick leave, this is something that your government could be doing, is being one of the provinces to start. You'd be the first province to lead the way with 10 paid sick days. And I think that's something that you could be very proud of. I think that's something that workers in this province would be extremely appreciative of. I think it would help in terms of recruitment and retention. There are many economic benefits that would be associated with that, I've spoken to at some length here in the House before. So I think we're seeing more and more. I mean, we saw with just prior to the federal election where there was a commitment to 10 days of paid sick leave by the Liberal government for all federally regulated workers. And there was also the statement by the Prime Minister that they would be working with the provinces toward this goal across each provincial jurisdiction. And so this is something that I think we will see becoming more and more prevalent. And I'm interested to know, has your ministry been in any discussions with the federal government on this front to date?
Yes, we've been contacted by the Minister Seamus O'Regan, who has asked where the provinces are or where our province is at, and I've talked to a number of my counterparts, and we've had joint calls on it. And certainly the federal government is supportive of it, and they've indicated that's what they're doing with their federal employees. We've indicated to them collectively, or from virtually every other province, that if the federal government wishes to do that, then they should be prepared to pay for it rather than saying the individual employers should be paying for it. So he was going to consider where they might be on that. But so far as I know, there has been no uptake from any of the provinces on that point. Out to him that we already have a starting point of 5 more paid days than virtually every other province. I understand what you're advancing.
Thanks. And I guess just on that note, I would hope you're not suggesting that workers should have to use their vacation pay when they're sick, but I'm going to move on now. Minister, last year in estimates, you had quoted Statistics Canada data that stated 46,000 Saskatchewan workers were considered low-wage workers. And I'm wondering, do you have any updated numbers on this front since last year available?
There were approximately 46,100 low-wage earners in Saskatchewan, or 10.2% of paid workers in the province. So that's what I think most current numbers that we have. Wait, hang on. No, I've got newer numbers. Based on Stats Canada data for 2021, an increase in the minimum wage will have a greatest impact on what they refer to as 49,600 low-wage earners, or 10.5% of paid workers in Saskatchewan, which there's a total of 472,300 in 2021.
Thanks for that. So we've actually seen a pretty substantial increase, looks like, from 2020 to 2021 for what Stats Canada qualifies as low-wage workers in our province, which is concerning. So I'd like to know, is this something that you folks are aware of? What is the threshold for the hourly rate that Statistics Canada considers low-wage, and what percentage difference is this from Saskatchewan's minimum wage? You know? Siri doesn't know. Okay.
It's actually tied somewhat to minimum wages, from 5% below to 10% above minimum wage would be regarded as a low wage earner.
Sorry, could you repeat that, Minister?
5% below to 10% above minimum wage.
Okay. 15? Okay. Okay. And so then, I guess, yeah, on average, what percentage difference does this represent? From, so 5% below to 15% above minimum wage, is that what you said?
I think there's a pool of people that are in that range, and that number of people may have increased as we're coming out of the pandemic. There would be more people that would be at entry-level wages.
Pandemic?
People that are going back to work, starting work, whatever, that we would have more people entering the workforce as people are going back to work. Some would go back to work at their homes, but some people would have them. So I'm not sure what percentage you're looking at. The low wage would be regarded as that pool of people that are working at an hourly wage that is 5% less than minimum wage to 15% above.
Okay, thanks for clarifying. And so, yeah, I mean, I guess who knows what all of the reasons are for that. I'm not sure that that can be attributed to COVID, but it's certainly notable and not in a good way. And so then, how many workers are currently earning minimum wage in Saskatchewan?
I don't know that I have that number, but I can say that as of 2021, there would have been 13,100 people that would be earning wages near them when in that 5 to 15%.
Okay. Yeah, interesting. I guess the most recent I had seen is over 16,000. But if you have something different, interesting. And so that's just, yeah. So that's not actually minimum wage workers. That's just using that stats can, yeah.
The people at minimum wage plus those that are in that window that are above it. The reason that it's sort of captured in that kind of is the effect of a change in minimum wage would usually affect approximately 10% of the workforce that would either directly receive a benefit or would be close enough to minimum wage that they would end up getting pushed up in consequence. So a change to the minimum wage would affect roughly 10% of the workers.
Okay. And do you have the demographic breakdown of people who are making minimum wage in Saskatchewan, for instance, gender, age, ethnicity?
73%, these are the low wage earners, so it's slightly above as well. 73% would work in retail, trade, or accommodation and food services. 60% would be part-time, and 52% of them would be in an establishment with less than 20 employees. 47% were for people employed less than a year, and I'm going to come back to that in a minute. 90% of them were not covered by a collective agreement. When we started down the road after the formal election, we started looking at what minimum wage was. We raised the threshold for how much a person could earn before they paid income tax. So we raised that threshold, and it had the effect of taking 111,900 people completely off the tax rolls. So those people were able to go to work, earn their salary without any government taxes being paid by way of income tax. So that we were the best in the nation at the time. The interesting stat was that 47% of those people were at that level a year from now, but 53% of those people had progressed beyond that minimum wage. They were outside of that bracket. So it was for those people a starting wage, and they moved upward and onward. I can tell you that 57% of those people would have been women, 43% would have been men, 57% as well would have been people under age 25.
Okay. And do you know, I'm just curious if you know the percentage of people who are under the age of 18?
The number I have is those that would be under 25. I think it probably, we could look at the ones that have completed the young worker readiness certificate, but I don't think that would necessarily be a valid number to use, because it wouldn't capture all of them.
Okay, yeah, I mean, my understanding is that the majority of minimum wage workers are adults, in fact. And so just moving on a bit from here, Minister, as you well know, on April 1st, Saskatchewan's minimum wage dropped back down to being the lowest minimum wage in Canada at $11.81 an hour. With rising costs, people are struggling more and more, and we hear about it in our office. I'm sure that, you know, probably all of us do. So given this, why did the provincial budget not include an increase to the minimum wage?
The minimum wage is not paid for by the provincial budget. There would be virtually nobody that would be a provincial government employee that would be earning minimum wage. Almost all of the workers would be governed by a collective agreement, or would be beyond that. So it wouldn't be something that the provincial budget would be intended to capture.
All right. According to the most recent statistics available that I can find, as I said earlier, what I could find, there are over 16,000 Saskatchewan workers making minimum wage. So, I mean, I would be interested in where the numbers you had cited are coming from, and it, you know, just so I can have the most accurate information. If you can have a look as we kind of move on through the questions here.
Is it that you're asking?
Oh, I guess I'm saying that, like, the most recent information that I was able to find indicated there were over 16,000 Saskatchewan workers making minimum wage, but I think the numbers you had listed were more like, yeah, well, I mean, that was different, 13,100 people earning wages within that 5.
Information would come from Stats Canada. I don't think we've got another source.
You don't have any other sources. Okay, thanks. And so I guess, you know, my final question on this front is, will your ministry be taking steps to replace our province's minimum wage legislation with living wage legislation so that workers in our province will be legally entitled to minimum wages that reflect the actual cost of living, which would be calculated through a living wage calculation?
When we started and did the amendments to our legislation, we went through a process to determine what the minimum wage should be at that time. And then we wanted to take the politics and the swings out of it, so we adopted a formula. So the minimum wage will increase at a midpoint between the percentage increase of the consumer price index or the average hourly wage. So for example, last year the consumer price index increased 2.63%, the average hourly wage increased 0.07%. So the midpoint between those would be what the, and that actually has served the province and workers and employers by having something that is predictable and keeps workers above the point where they had the tax threshold that I indicated before that took 111,900 off. So we've adopted that, and that is the position of the government right now, is that we've adopted that. Some provinces have chosen to do something different, but that is where our province is.
Yeah, I know you've sort of stated before that, you know, this allows for predictability, but that doesn't help workers who are working full-time at a minimum wage job and simply cannot cover the basics that a person needs to live a life of any kind of dignity. So I was, and sorry if I just missed this in your last answer, but I was looking for the percentage changes in both the average hourly wages in Saskatchewan as well as for CPI for the past year.
CPI increased 2.63%, average hourly wage 0.07%. So the increase would be midway between those two numbers.
Okay, so in essence, you know, we can see from these numbers that the increase is not matching inflation, not even close.
I didn't look at it in the context of what inflation is, and I think right now inflation is quite high, but the CPI will change as we go forward, and I assume the average hourly wage will as we go forward. I don't know what it will be further down the road, but both the average hourly wage and the consumer price index will go up. The consumer price index we affect will accurately reflect what current inflation levels are.
Okay, so given the numbers that you have just stated to me, why do you feel that it's acceptable for the minimum wage to not be increasing at least at the rate of inflation?
Yeah, I think I'm going to ask the member to confine her questions to budget questions. We have the officials here to provide background or information that's here, so I'll let you save that one for question period.
Okay, I'm gonna move on a bit, Minister. I want to talk a bit about COVID and impacts on the workforce. One question I have is, what is the total number of workers in our province that have been displaced by COVID over the past year? Do you have that information?
Sure, what you mean by displaced?
Well, essentially that, you know, they've lost their job throughout the pandemic.
I don't know whether we would be capable of capturing that information, because there would be people that were sent home on a paid leave. There would be those that would have been subject to a layoff, and I don't know how many would have been recalled. It certainly had a marked effect on our workforce.
Okay, so there's no tracking by your ministry of how many were laid off versus recalled throughout the pandemic, nothing like that?
I think that information might exist in Trade Expert, because they do workforce development in there. We ensure that the benefits are provided, that people are able to come to the ministry and make sure that they're getting everything that they are entitled to, and given proper advice as to whether they're entitled to be getting a pay in lieu of notice or whatever. So.
Okay, and then I guess my follow-up question was, you know, what work?
This may not answer your question, but Mr. Tour says there was not a significant uptick in the number of complaints. Okay.
Sorry, in the number of complaints related to?
It would have found their way into the labor standards, folks.
Okay. All right. And then my follow-up.
Probably took the complaints the same way you did, that people would come to an MLA office or phone and say, what about this? Are we entitled to that? Or how do I work with workers on this? And our goal was to try and provide advice to both workers and employers as to what their obligations should be, and then we would try and refer them to wherever they need for outside help if they needed it, or if we were able to provide it from within.
Okay, so thanks for that. And my follow-up question was going to be, what work is being undertaken by your ministry to assist workers who have been displaced by COVID in getting back to work? And beyond, what you just mentioned about providing advice, what work has been or will be undertaken with this budget year?
I indicated earlier that the period of time that they held the obligation to pay severance pay in abeyance ended last summer. So following that period of time, people went back to work, and we worked with the workers to ensure that they were entitled to go back to work or that they were entitled to pay in lieu of notice. That's what our mandate was. And so far as I know, the people that work at the ministry I think they did an effective job at doing that. I know they did a variety of seminars for people and whatever it was, but I know that was something they regarded as part of their mandate.
Okay. All right. Next question is around the non-renewable sector in our province. Non-renewable energy sector, essentially, like for fossil fuel workers in our province. I'm wondering if there have been any initiatives pursued or if there are any dollars being set aside by the ministry in this year's budget that will effectively work to prepare workers in our fossil fuel industries for a future energy transition.
That is not something that would be part of the mandate of this ministry. I think if you were to ask the question of some of the crowns or some of the others, they might be able to provide you with some information.
Immigration and career training.
Yeah, the information career training folks may be able to provide some information that's there as they go through the transition. Okay,
so I'm hearing that that's got nothing to do with your ministry. Okay. Well, I mean, just for what it's worth, I guess, and I would suggest that perhaps you should make that part of your mandate going forward. Moving on, I have just a question, Minister. Last year, in estimates, you had referenced your government's plan to add 100,000 jobs by 2030, and I'm interested to know from your ministry's take how many of these jobs the government is hoping to create in specific, sector by sector. Do you have that information?
No, the job creation is not something that's done in this ministry. That would be a question for Minister Harrison.
Okay. All right. Thanks. I'm just going to skip around and then kind of get into some OH&S and WCB related questions. You had mentioned earlier the new provisions under the Employment Act with regard to sexual harassment protections for workers, and I do commend your ministry, your government on that. I think that was an important step for, as you said, students as well as gig and contract workers and those that are exposed to sexual harassment in the workplace. So we're, of course, very happy to see that, and also very grateful to the many advocates who made that a priority and brought that to your government. And so I'm wondering, I think you'd mentioned that the changes came into force January 1st of this year, and I'm wondering if OH&S has received any claims related to sexual harassment since that time, January 1st.
There are no complaints based on the expanded provisions since January 1st, 2022. That's not to say there wasn't other harassment complaints that would have come in for other things on an ongoing basis, but the expanded provisions, there has not been any specific ones they're able to identify.
Thanks. Then
I would like to think that it's because the harassment isn't taking place, but my guess is it's not likely the case. It's a matter that people have not yet chosen to come forward or aren't aware of the expanded coverage, and I think that's part of our mandate, is to try and make sure people are aware that that's there. It went through this House, and I think when somebody goes through this House, we think it's incredibly public, but I frankly most people don't follow things that are here. So I think that's something we want to make sure that we make people aware that there is expanded coverage.
Yeah, I totally agree. And I'm interested to know what the ministry's plans are for the upcoming budget year in that regard to make this these provisions more publicly known, and what sort of a campaign that your ministry might be
I
initiating.
think they're going to watch things and do a bit of an analysis as they go forward. And I know it's on websites now, and I think they'll work maybe in other areas to see to it that the information gets out. Go ahead.
Hello, I'm Samima Haq, Assistant Deputy Minister for Ministry of Labour Relations and Workplace Safety, and we are creating quite a few resources, training material that will be posted on Saskatchewan.ca, videos that might be helpful in regards to defining what is in the Act, explaining our regulations and of assistance to both employees and employers. So educational resources. In addition, we're also working under our WorkSafe partnership banner with WCB Prevention side to have resources available through that website as well to educate.
Okay, thank you. Yeah, that's good to know. I don't know how many average folks in Saskatchewan pour through the Saskatchewan.ca website, just to be honest, you know. It's good that it's posted there, but I guess I would hope that, you know, your ministry undertakes a more fulsome campaign to make these new provisions more well known. I think it's certainly warranted. You know, people should be made aware of the good work that's been done by your ministry in bringing these changes in. And I know that, you know, as I said, had estimates with for status of women last night, and you know, they've got a campaign underway there that they're collaborating with other ministries on around raising awareness around domestic violence. And yeah, I'm sure there could be some discussions or collaboration there if you saw fit. I will move on to ask about, I'm wondering the total number of OH&S inspectors in the province.
$69.
Okay, thanks. And what is the total number of unannounced site visits that have occurred over the past year?
Yeah, I'll give you a number of statistics. There was initially a real concern that the term was used where it was random, and that was a problem because random could have meant anything. So you used the term unannounced, which is probably a far better to do. When they were random, it was, oh, well, there was a bookkeeper with only one person that was self-insured through WCB would get a visit, and they were working at a table in their house. So a visit of that probably wasn't going to mean as much as a roofing contractor or something like that. So there was 4,262 work site visits. This is as of February 28. 982 of those were COVID related. So that would have been either a COVID complaint or a COVID issue. 1,790 were targeted intervention. That would have meant that they were directed or priority employers, or ones that there was a specific reason why those ones would have been done. They would have had a prior visit or an outstanding issue, whatever. 1,215 were officer initiated, 512 were result of complaints, 745 were as a result of notifications. Out of that, 4,262 1,660 received notices of contravention, 2,226 received compliance undertakings, 2,160 had an officer's report, and the rest of them had some form of notes on the file. Of those, there was 22 had summary offense tickets issued. 23, sorry.
Thanks. And so I just wasn't quite clear from your answer, like how many of those were unannounced site visits?
That would have been 1,215 would have been the officer initiated. Okay. Would those have had some notice to the employer? No notice on that 1,215.
Okay. And so the rest I'm assuming then the employer was aware that the inspector would be showing up.
It could have been a variety of things. They could have done an unannounced inspection some weeks or days earlier and said, we'll come back and follow up. Or it could have been a piece of hoist equipment that needed a repair or an update, a guard that was there and said, we're going to come back and make sure that it was done or whatever else. And then they would sort of said, we'll do whatever else. The mining operations in the province, which I think do a really good job on working workplace safety, it's difficult to do a site inspection where you go underground, where you just show up and say, we're going underground today. You know, they have to shut down skip loaders or whatever else. So those ones, they have to work with the ones that are there. I'll give you a few more files. 27 files were sent to justice, 17 prosecutions initiated, 10 convictions, a total of $1,475,600 in fines, plus 20 stop work orders. So I think the thing I'd like to impress is that the OHS workers take it really seriously and are willing to refer it out to for prosecution where it's appropriate, or to issue the summary offense tickets. And I think they do a remarkably good job. We have a prosecutor designated to this, a full-time prosecutor, and I think there's a second prosecutor that does additional work on it to make sure that things are done in a timely manner. The good news on this is that over 90% of the employers in the province have reached mission zero, operate injury-free. The sad part is that we have nearly 10% that have got safety issues or injuries.
Okay, thanks. That's really good to know. So of those 15 which were officer initiated, what sectors were these initiated in overall? Like, do you have the top 3 sectors or none of that? Okay.
For a variety of sectors, you know, our occupational health and safety officers visit from a simple welding shop to a you know, meat packing plant, to the refinery, to big manufacturing sector. So they visit all of those sites.
I think as they're determining where they're going to go to, they're trying to make their visits have the most impact. So they'll go to either a rate code that has got an abnormally high number of complaints or that has not come down, or a specific employer, or an area of the province, which might be southeast corner where there's been a lot of oil exploration or something. So I think that what they're doing is rather than focusing on a particular segment, they're trying to target their energies where they will make the most benefit.
We can provide information for overall inspections.
Yeah, go ahead, please.
Not just the officer-initiated one, but of the COVID-19 related worksite visits, they were in all sectors, 982. Asbestos-related worksite visits were in 117 worksite visits. In the healthcare sector, we had 557 worksite visits. Out of these, 230 were COVID-19 related. In the manufacturing sector, we had 318 worksite visits. 63 were COVID related. Mining sector, we had 211 worksite visits. 36 of these were COVID-19 related. Residential construction, we had 316 worksite visits, 15 were COVID related.
I'm curious to know on that, with the COVID-related visits, which, like how many of those would have resulted in either convictions, fines, stop work orders, et cetera?
Any stop work orders related to COVID-related worksite visits? I have contraventions, 70 total of number of contraventions. So 329 plus 70 were total contraventions issued under so a little bit, one less than 400, so 399.
And that's related to COVID?
That's since 2020. The goal at the beginning of the pandemic was not to look for people to charge, but to try and get compliance. There was a lot of lack of knowledge, lack of understanding. So they weren't seeking initially to lay charges. Later on, there was probably a bit of a shift on the part of some of the employers or some businesses that were choosing to be non-compliant.
And so just to get clear on those numbers,
Yeah.
you said
Yeah, I think
329 plus
give-
17, is that what
Nope,
you
70.
said?
So 399 notices of contravention were issued for COVID-related worksite visits.
I think Greg's got some other information on the timing, if you want to.
Yeah, I just was saying to the minister that what we have noticed is over the period of the 2 years of COVID, the number of contraventions that we issued significantly decreased, and I think that's also in part to people, understanding what their obligations are, understanding what their responsibilities are, and as we went through, you can see the numbers very quickly decreasing, particularly over the last 6 months.
Okay, great. I'm getting a little short on time, so I might just skip around here for a little bit. I did want to know, is the Workers' Compensation Board still requiring PCR tests for claimants related to COVID?
No, they're not. Verification from a doctor is sufficient.
Okay, great. And when did that change occur?
So that changed during the December, January timeframe, when there was the increase in Omicron, and we had made a decision then that we would accept any third-party medical confirmation that there was COVID, whether that was a PCR test or, yeah. So
Okay, that's great. So PCR test or doctor's note will suffice at this point in place of a PCR. Sorry, did I just say
a
PCR?
rapid test or, yeah, a
I meant
doctor-administered rapid test or PCR.
or rapid test or doctor's note is now sufficient as opposed to
As long as
a
the
PCR.
doctor confirms that there's COVID, yep, we'll accept it.
Okay, that's great. I'm really glad to hear that. And so now I understand that at least initially, WCB had said that they would, on a case-by-case basis, reimburse claimants who access private PCR testing. And so, curious to know if WCB has reimbursed any claimants, and if so, how many?
I don't know how many, but we would, if somebody went to a third party, contacted us, went to a third party, and where we recommended they go to a third, not recommended a third party, but suggested they could get the test from a third party, we would pay for that test. So I don't know how many, but that was not an issue for us in terms of paying third party.
Then?
Not to my knowledge.
Okay.
No.
Okay. And then I have a few more questions here around WCB. How many WCB claims were made in total over the past year that were related to COVID?
I'm just going to grab my binder.
Sure.
I'm pretty sure I know the number off the top of my head, but. So in 2021, there were 1,414 COVID claims submitted. And in 2022, there's been 891. Sorry.
Okay. And then I guess for each of the years of these claims, how many were accepted and how many were rejected?
So 60, going back even to 2020, all through the pandemic, 63% of COVID claims submitted were accepted. Of the ones that were not accepted, there was no medical diagnosis of COVID. That was the majority of the reason for non-acceptance. Some, when working with the worker and contact tracing, there was no work-related exposure. In many cases, the worker verified a non-work-related exposure, such as a barbecue or something like that outside of work.
A non-workplace related exposure, like hypothetically, or how does that work?
Through contact tracing.
Yes, I understand through contact tracing, but like, I guess I'm just trying to understand, are you saying that, you know, if there was determined to be someone with COVID at a barbecue and someone, like what would happen, just curious, if there was, you know, through contact tracing, if there was someone at a barbecue that a worker had attended with COVID and someone in the workplace who also had COVID, then how would that determination work?
Through the conversations and contact tracing, we would try and determine the proximity. Even if two people had COVID within the workplace, they might have never came in contact with each other. They could be in one end of the hospital and in the other end, or one end of the manufacturing plant and opposite. So we would actually try and verify, is it possible that there could have been transmission within the workplace or outside of? In most cases where we confirm transmission outside of the workplace, it was the workers who helped verify that.
Okay, thanks. And so sorry to put a hypothetical to you, but like, I am wondering, I guess, so if a worker presented a claim related to COVID and, you know, there was someone determined to also have COVID in their workplace and someone at, say, a barbecue they went to and they were equidistant away from both people who had COVID, how would that determination be made?
I think you're asking a hypothetical that becomes a challenge. I think the role of the Workers' Compensation Board is to make a factual determination, was it a work-related contact or not? You know, generally speaking, on the balance of probabilities, all else being equal, it likely will fall in favor of the worker. But they would do, ask the questions, where were you, when were you, whatever else, to make an appropriate determination. And I think the stats sort of bear that out. 63% of the claims that were filed were accepted. Of those that were not accepted, the vast majority of them that weren't accepted didn't have COVID. So you get down to a relatively small number or percentage that were denied because it was not determined to be a workplace exposure. So I think if you remember back to the beginning days of COVID, there was a group of dentists that had a bond spiel together. So if you would have been in the household of one of those people, chances are that's where you got it, rather than at your workplace. So, you know, I think WCB has done a good job of making those determinations. That's their role to do that. But I don't think it's fair to give them a number of hypotheticals, I think all else being equal, they find in favor of the worker.
Yes, thanks. And, not trying to be difficult, just curious when, how, if you're using a balance of probabilities, how you would determine if, those circumstances were quite similar, but I'll move on. I wonder also then how many fatality claims were made, if any, over the past year that were related to COVID?
I think we can give you a number going back to day one.
Sure, great.
There were 4 fatality claims accepted related to COVID.
Okay. And so how many claims were made? And how many were rejected, and you said 4 were accepted? Is that correct?
I don't have the specifics in here. I don't know that any fatality claims were rejected. There may have, I'm thinking back, there may have been 1, but part of that was us working through with the employer to get all the proper information. So I don't recall us rejecting any. As long as we could connect it to the workplace, we accepted those fatalities.
Okay, so you don't know then off the top of your head how many fatality claims would have been made in regard to COVID?
The 4, and possibly there may have been 1 that wasn't accepted. But.
Right. Okay. I'm wondering as well, Minister, what is the ministry doing presently to make sure that workers have safe workplaces in terms of the health and safety risks associated with COVID? So if we're heading into another wave of COVID, why is it that neither masks nor any other COVID-related PPE are required in workplaces in Saskatchewan?
I think we look to the Ministry of Health and Dr. Shahab to make determinations as to when there are additional rules required, both by way of masking, various PPE, and those things. Those are not something that would be done within the ministry. There would be recommendations that would come from the Ministry of Health, and then that would be done by way of an order in council or pursuant to the emergency order that was in place.
Okay, thanks. And just so I'm clear, then.
I'm going to let Mr. Trurier put it. They work with WorkSafe to try and mitigate exposure control, but the requirements for masking, etc., are done properly. But I'll let Mr. Trurier give you the better specifics.
Thanks. So one of the things that we have done over the course of the pandemic was, again, working through WorkSafe, which is the partnership with Workers' Comp, is, again, ensure that there are resources available to employers. And, of course, all employers have to do a risk assessment of what are the risks in their workplace. But as it relates to exposure to things like COVID, there are resources on the WorkSafe site around how to conduct an exposure control plan, making sure that they've taken the correct steps and understand what they need to put in place in order to protect their workers.
Thanks. And my understanding is that, earlier on in the pandemic, it was the case with COVID that employers had to have a plan related specifically to COVID, and now that's just like reverted, I think, back to how you would deal with any communicable workplace disease. Is that correct?
I would say at that time, with the public health orders in place, there was medical experts that had actually, through that process, determined that there is a risk presence for community transmission that's high. Therefore, an exposure control plan was required based on that risk assessment in itself. That was for province-wide. Employers have always had an obligation to conduct a hazard assessment within the workplace, and whatever risks are identified through that hazard assessment, including diseases or chemical exposure or any other hazard, they need to have a plan in place to protect the workers. So that condition was not expanded or at any time minimized. The public health order had some additional factors in it that required.
Okay, thanks. So I guess you can imagine where I'm getting, what I'm getting at here, right, is that we can see that there's continued and increasing spread of COVID throughout Saskatchewan. And so the fact is that there's currently no mandated requirements for employers in terms of providing PPE to their workers to keep them essentially safe and protect them from contracting COVID. And so that's obviously problematic. And I would suggest that, I know, Minister, that you said that you looked to Dr. Shahab for recommendations from the Ministry of Health, but you know, the fact is that the Ministry of Labour is responsible for the conditions of workers in this province. And so I would suggest that, I would certainly hope that your ministry would be able to take steps in this regard without having to seek approval from any other avenues in government. And are you saying that's not the case?
Everything we can to keep our workers safe. We're now living in a world where COVID is accepted to being part of it. The pandemic will continue on, and we'll watch what takes place. We'll raise issues, and we'll work with Dr. Shahab, who has at this point in time said that he does not recommend or is not urging any additional measures to be taken. Having said that, you know, we walk through and we see people get COVID, get better. It's no longer a disease where you end up on a ventilator. Not saying that there isn't people that have a bad outcome from it. I think this is how we live with the new normal.
Right. Yeah, I understand that's consistent with your...
To minimize the responsibility of an employer to maintain distancing or to make equipment available, and I have confidence in the officials to work with the employers, but we're not looking at adding a regulation or making a change at this point in time.
And is that no matter what happens throughout the pandemic here?
I said at this time.
Okay. Okay, well, I mean, you know, although we're getting less regular reporting, we can all still see what's happening in terms of the numbers and the death rates.
The issue of reporting, and I didn't come here with the idea of debating, I'm specifically avoiding that, but virtually every jurisdiction is now moving to weekly reporting, and I think they are because it's difficult to get daily averages. Reports sit, and then all of a sudden there's a day that, oh, well, you've got 4 days worth of information there instead of 3, and the numbers are now low enough that weekly seems to be a better indication of where the numbers are, and that's done virtually across Canada and well into the U.S. That reporting is now weekly.
Mm-hmm. Yeah, and you know, appreciate your comment about not coming here to debate, but I mean, also, you know, as the critic, it is my role to bring forward concerns from stakeholders, which is what I'm doing here now. And so I would hope that you would be interested in hearing some of those concerns and taking those into consideration. But I'll move on. I do have some more questions around case processing for WCB. Wondering if we can have an update on open to close case times for WCB claims, being the average time it takes for WCB to resolve a case.
So the open and close, the average duration of a claim is just over 40 days. So that's open and close. The time to adjudicate is, I don't have the specific number, but obviously it's less than that. So.
Thanks. And what are the targets you set there?
Well, we want to be sensitive to the targets because it's about a safe recovery and return to work. But our current target is 38 days. We think if we can get a little quicker at adjudication, it'll benefit the whole system. So. Thanks.
And how many WCB claims in total were made over this past year?
$25,751 25,751 claims reported to WCB.
Okay, and of those, how many were accepted and how many were rejected?
So, good question. Tell you that of those claims that were reported, 14,342 time loss claims were accepted, 7,888 no time loss claims were accepted, and then the balance would have been whatever the math is, which I do have here, but the balance would have been denied. Well, not denied. Many of the denied claims are sometimes just dropped or withdrawn by the worker. So.
Okay. And then wondering if we can hear how many claims in total were made over the past year for just physical injury claims.
Of the 14,342 time loss claim accepted and the 7,888, the only difference from a physical injury would obviously be the psychological injuries, and I have that information right here. There we go. COVID. The psychological injuries, 233 psychological claims were accepted in 2021.
Okay, and how many total psychological claims were made in 2021?
A total of 678 psychological claims were submitted.
Pretty low rate there. It looks like, and I guess that would reflect what we're hearing, and just, you know, just to say that's one of the concerns that is brought forward is the outcomes overall, I guess, the experiences people are having in terms of making psychological claims, and also the duration that it takes from open to close for those claims. I understand, at least from what we hear anecdotally, that's often, those are taking quite a bit longer than physical injury claims. Can you confirm if that's true?
Challenge initially on obtaining the psychiatric information for it. There was a test that was required sort of to meet a threshold, and I don't know whether the testing facilities have gotten better. There's more people qualified to do it, but there was a psychological requirement that had to be met. And once the people got into the testing process, were able to, but I'll let Mr. Tremaine speak to it. He probably has more information.
So in terms of acceptance, since the legislation was passed for presumptive psychological, the number of claims submitted have been increasing, you know, which was kind of part of the goal of the legislation, and the acceptance rate has increased from 28% to 38% and now up to as high as 45% in 2020, and then dipped down to 42% in 2021. So there has been an increase in acceptance. We do have a specific psychological unit that focuses. The durations of psychological claims have dropped over the last 3 years. So there's been a lot of work put into trying to understand how to effectively adjudicate and manage psychological claims.
Okay. And what would, I don't know if you have available, but what would like the average duration of a psychological claim be? I know overall you said just over 40 days, and what would that be for psychological injury claims?
It's just over 60.
Just over 60 days?
Yep.
Okay. Okay. And so am I right in assuming then that you had listed 670 total claims made under psychological injury, and then the rest of the claims that you had listed as reported, that 25,751, the remainder would be all physical injury claims. Is that correct?
Or occupational disease, yeah.
Or, right, okay. Thanks. Okay, and then so, just gonna move down a little bit here. I wanted to know, is there a common reason for rejection of psychological claims?
I wouldn't say there's a common reason other than we register the claim, we start working with the claimant, and then we just simply work backwards to establish two things. A, is there an injury based on a psychological assessment? And then B, was that injury in the balance of probabilities work-related? Mm-hmm. So that's really, each case is very unique and individual, so there isn't really a main reason why we would not accept it other than trying to determine those two factors coming together, injury and work-related.
Yeah, no, that makes sense. And just for my own knowledge, when we're talking about whether something is work-related, and I know we're using the balance of probabilities test here, but for example, with a psychological injury claim, would, if someone, I assume, had some form of pre-existing sort of psychological diagnosed condition, would that preclude them from, it would not, if it were, no. How does that work?
Like even a physical injury, just because you come with a pre-existing condition doesn't mean that your work didn't contribute to that injury. We all come with our faults.
Okay, that's good to know. I'm wondering about, specifically about serious injury and fatality rates. How many serious injuries were there over the past year reported?
We have an in the report in our 2021 report. We have an average of about 2,500 serious injuries per year, and the number I've got here is from 2011 to 2020, and I'll explain what I mean there. There was 24,737 serious injuries. That's the statistic that we've published. The reason it's a 2020 statistic is because sometimes there's a timing in order to understand, like a psychological injury or something, when an injury is actually serious. It doesn't just immediately manifest itself as a serious injury. So.
Okay, great.
We made a determination when we changed the legislation to include any worker, so it wasn't just firefighters, police officers, whatever else. It got right down into anybody that had it, and it could be something, some things that you would never anticipate would have been there. And I think was worried initially that is this a step too far, and I don't believe now that it was. I think it was absolutely a right thing to do, but I think it has made it more of a challenge for WCB to identify or work with the statistics and say this is the type of problem we're having, or this is the type of things we can do to reduce or minimize them, because the claims can come from virtually anywhere.
Yeah, I think we're one of only 3 jurisdictions that accept any type of psychological injury or from any occupation. Some jurisdictions limit it to certain occupations and or certain types of psychological injuries. We don't.
And just, has that always been the case? That, I mean, not with the presumptive clause, but with psychological injuries? I mean, that's always been covered under the Act.
Yes, I know of cases dating back to 1974 where we accepted psychological injuries.
Yeah. Okay. Thanks. And so I have many more questions, and of course never get to them. We'll just try to pick my last question here, I guess. Related to occupational health and safety and a worker's right to refuse unsafe work. We all know under the Sask Employment Act, workers do have that right to refuse unsafe work, yet still far too many workers are being seriously injured, as we've heard, or killed on the job year after year. And so I would like to know, Minister, what sort of work will be undertaken by the ministry within this upcoming budget year fiscal year to address this tragic reality for so many people across our province, so many workers?
Over the time that we've been in government, the injury and death rate has come down substantially. I think that's credit to the workers in the province, the employers, the employee training, identifying prime contractors on construction sites, and having workers better trained on safety things. And I think I would regard it as a work in progress. It's not going as fast as we'd like it to do. We used to be among the worst in the country. We're not anymore, but we still have a place to go. There's a shifting mentality when some of the mining companies first started to embrace the notion of safety. We had some suppliers did not want to do business with them because it was too difficult, too many safety rules, and declined to do it. Over a period of time, those employers have now come back and said, no, we're doing it. It's the new normal. We're absolutely comfortable doing it. So it has come along, and it's spread from some of the larger companies down through the smaller ones. So we'll continue to work, to enforce, to prosecute, to train, and to try and take a step forward. The only acceptable number is 0, so we have mission 0, and that's the challenge of Work Safe Sask. Later this month, we're going to be in this chamber reading the names of the workers that were killed on the job, and for me, that's the toughest day of the year. But for the family members that have lost a loved one in that, it's not just one day for them, it's every day. That's their new life. So I think we'll want to continue to look and identify the different things that were there. I spent some time talking to Sean Tucker, a U of R professor, on these things, and I'm going to ask him, not that I want to spring things on our staff today, but I will, to not look at it just on the basis of what our stats are on the deaths, because we're such a small pool. One year we'll have 2 people killed in an airplane crash. The next year we'll have 2 electrocutions, and it's difficult to say what a trend or what a pattern is from there. So I think I was going to ask people to work with some of the other jurisdictions to say, by pooling our data with them, can we better identify areas that we need to focus on and need to work on? So I think those are the type of things that we'll need to work on. Somebody used the term, and I didn't accept it, but it may be a fair term, that we've taken the low-hanging fruit, the larger employers that have got safety divisions or safety units, but I think now we need to deal with the 2- and 3-person jobs. I live in an area of the city where there's new homes under construction. I drive through there and I see the ropes lying across the roof, not attached to the worker. I don't stop and yell out the window, but probably I should. And then, you know, I mean, the equipment is usually there, and we need to do it. So I think it's a matter of sometimes enforcement, sometimes training, sometimes education. I'd like to get some better data so we know where to focus our energies, where we go to. We've got a consultant in working with them now to try and focus or get our staff working on it. But to your point that it's unacceptable, it absolutely is. And it's not just unacceptable in our province, it's unacceptable across the nation. So.
Agree. I promise I will wrap up right away here, but just to that, I appreciate your comments. And I just wanted to bring to your attention, you know, maybe you've heard this as well, but you know, what I've heard from many folks in my former line of work and even still is that there are a lot of barriers in place in terms of accessing and exercising a worker's right to refuse. And so I would encourage your ministry to look at ways to make that process more accessible to workers and to make sure that workers are apprised of that right that they have more readily. But appreciate your comments. Really appreciate the time that everyone's taken here tonight. Thanks a lot, Minister, for answering my questions, and to the officials, really nice to meet you, and thanks for all the work you put into this process, and thanks for bearing with me as I'm a little bit new to this role in full. And with that, I'll end my questions. Thank you, Mr. Chair.
I'll just briefly the committee members, the opposition member, Ledge Assembly staff, people that are in the room today, broadcast services, building staff, building security. But I would like to specifically recognize the people at Labour Relations and Workplace Safety who every day work hard to make our province a safer place. I mentioned the work in progress, and they are moving it along. And also the folks at WCB. I want to thank Mr. Germain for coming out. They are on the other end of it, so they see where things have not gone as well as they should. So I want to thank all of those people for the work that they do year-round. Thank you, Mr. Chair.
All right, thank you, Mr. Minister. Thank you, Ms. Bowes. Having reached our agreed time for consideration of these estimates, we will adjourn consideration of the estimates for the Ministry of Labour, Relations and Workplace Safety. I would ask a member to move a motion of adjournment. Ms. Ross has moved. All agreed? All agreed? Carried. This committee stands adjourned until Wednesday, April 23rd at 3:15 p.m. Thank you.